When we think about recovery after a stroke, our minds immediately jump to the limbs, right? We see the arm that won't cooperate or the leg that drags. But for years, therapists saw their patients hit a frustrating plateau. So what if the key wasn't in the limbs at all? What if it was hiding in plain sight, right in the center of the body? Today, we're going to dive into the part of recovery that was, for so long, completely forgotten: the trunk.
This quote from the incredible physiotherapist Patricia Davies, man, it just gets right to the heart of it. This isn't just some dry academic theory. It's about a real human desire for freedom, for ease. And it was that frustration, seeing that longing in our patients day in and day out, that pushed her to completely rethink how we approach rehabilitation.
It's such a simple question, isn't it? But asking it changed everything. It forces us to wonder, have we been so focused on the edges, on the limbs, that we've totally missed the very foundation of all our movement? Okay, this is going to sound wild, but for decades, the trunk was basically a ghost in hemiplegia treatment. When Patricia Davies went looking through the research, we're talking over 5,000 articles on the topic, she found exactly 0 studies on the trunk muscles. A stubborn 0. The body's literal centerpiece was almost completely ignored.
Now, this realization didn't just pop up overnight. It came from watching people struggle. Therapists kept noticing that no matter how much they worked on getting those selective movements in the arms and legs, their patients would just hit a wall. They couldn't get that true freedom of movement, and it's because their central foundation, their trunk, wasn't giving them the stability or mobility they needed. It was the missing piece of the whole puzzle.
So why is the trunk so darn important? Well, think of it like the anchor for literally every other movement. Without a stable, adaptable center, the arms and legs are just kind of left flailing. And the reason why all comes down to some really brilliant biomechanical design. See, our body has these 2 girdles that have totally opposite jobs. The shoulder girdle is all about mobility. It practically floats in this web of muscles so our hands can reach, grab, and explore the world. But the pelvic girdle? It's the complete opposite. It's this massive, stable base for our entire upper body. The trunk is the critical link between these two, and it needs to provide that rock-solid stability from the pelvis to allow for all that amazing freedom at the shoulder. To really get how these trunk muscles work, there are 2 fantastic analogies. First up is the bridge. So picture someone doing the classic push-up, or even just bridging up from the floor. Their hands and feet are the supports. What's stopping their whole body from just collapsing in the middle? Well, it's the muscles on the underside of that arch, their abs or their back extensors, that have to fire up to hold that position against gravity. And the second analogy is the tentacle. Okay, now imagine you're sitting in a chair and you lean back. Your trunk is moving freely through space, kind of like a tentacle, right? So what stops you from just tipping right over? It's not your back muscles. It's the muscles on the front, your abs, that are acting like brakes, lengthening under tension to control that movement. That's what we call an eccentric contraction. Getting your head around both the bridge and the tentacle is absolutely key to spotting what's gone wrong after a stroke. So knowing the theory is one thing, but what does this loss of trunk control actually look like in a real person? The signs can be kind of subtle, but I promise you, once you know what you're looking for, you'll start seeing them everywhere.
Now here's one of the most profound insights of all. After a stroke, movement doesn't just get weaker, it often regresses. All that sophisticated, fine-tuned control of an adult is lost. And what comes back are these basic blocky movement patterns that look a whole lot like a baby first learning to move against gravity.
And you can spot these signs in really simple positions. Like if a patient is just lying on their back, their belly button might actually be pulled over towards their stronger side. That's a huge visual clue of a muscle imbalance. But the biggest giveaway is this loss of separation. If you ask them to lift their affected arm, their entire rib cage might just lift right up with it. That inability to move one part of the body without everything else coming along for the ride, that is the core problem.
Okay, let's look at a classic example you'll see in standing. To lift one leg and take a step, you need the trunk muscles on your standing side to fire up and hold your pelvis nice and level. But when those muscles are weak, the patient compensates. They do this big, dramatic shift of their entire pelvis sideways over their standing leg. It's a clever workaround for sure, but it's super inefficient.
And here is where it all clicks into place. This is the exact same strategy a 10-month-old baby uses when they're first learning how to stand. The patient isn't making up some new, faulty movement. They are literally reverting back to a foundational motor pattern, one that was programmed in their brain a long, long time ago, because the more advanced, sophisticated control system has gone offline.
All right, now for the really practical stuff. How do we actually assess this?
The key is just to observe the trunk in a few different positions, giving it some simple, structured challenges to see how it responds, or, how it fails to respond.
So we start in the simplest position, lying down. First, just look. Is the trunk symmetrical, or is that belly button pulled off to one side? Next, you want to check for rotation. Can you gently move their shoulders and pelvis separately, or does the whole trunk just move like one solid block? And finally, you look for those primitive patterns. As you help them bend their affected leg, watch to see if it automatically swings out to the side. That's a classic sign that the selective control just isn't there.
Now, sitting is a huge one, right? It's so fundamental to daily life. Start by just looking at their posture. Are they sitting evenly on both sides, or are they kind of collapsed onto one? Then check if they can isolate their pelvis. Can they do a little pelvic tilt, rocking it forward and back? That tells you a ton about their fine control. But the most revealing test, the real gold, is in the weight shift. When they move side to side, we get to see their automatic balance reactions kick in, or we see where they fail.
So here's exactly what an abnormal reaction looks like. A healthy person, when they shift their weight to the right side of their trunk automatically shortens to keep them balanced. Simple. But here, as the patient shifts weight towards their affected side, the trunk just fails to shorten. Instead, you see the shoulder hike up in this compensatory pattern. That is a crystal clear sign of lost selective trunk activity.
All right, let's look at one of the most complex things we do every single day, just standing up from a chair. It requires this powerful, coordinated dance between the trunk and the legs. Honestly, analyzing this one movement can tell you almost everything you need to know about a person's trunk control.
So, what are you looking for? A normal sit-to-stand requires you to lean forward to get your nose over your toes, which lets your ankles bend properly. Watch and see if the patient can even do that. Are they putting weight on both feet equally? But the biggest red flag of all is what's called an extensor thrust. Instead of moving forward, they just push straight up and back, often throwing their head back. It's a powerful, primitive compensation for a total lack of fine control in their trunk and legs.
So after all that, what's the big picture here? What's the main thing you should really take away from all this? Well, it's not about adding one more little assessment to your checklist. It's about fundamentally changing how we see the entire problem.
At the end of the day, focusing on the trunk means we can stop chasing symptoms out in the limbs and start treating the actual root cause of the problem. It's a total shift from an outside-in approach to an inside-out one. When you rebuild that central foundation, you give the arm and the leg a stable base to work from. And that unlocks this incredible potential for movement with more freedom, less effort, and way more skill. It really is a shift in perspective that opens up brand new pathways for recovery.
And that kind of leaves us with one final thought, doesn't it? The trunk was overlooked for decades, just hiding there in plain sight as the centerpiece of movement. It really makes you wonder, what else are we missing? What other fundamental, obvious keys to recovery might be sitting right in front of us, just waiting for us to shift our perspective?